Good day, everybody. My name is Suzanne Gelderblom. I'm one of the psychologists working at Stabilis Treatment Centre. Today, I'd like to discuss the dry drunk syndrome with you. I'm going to start off with an example. Bodily or physical injuries often require physical therapy during and after the healing process. The benefits of rehab are that the person experiences less pain, gets back to some or at least a bit of their normal functionality and mobility, and it avoids further complications down the line. Foregoing physical therapy increases the risk of further injury. The same can be said about recovering from substance abuse or alcoholism. Getting sober is certainly a vital part and a very important part of your recovery process. But without treating the underlying causes and the psychological triggers, the rehab part of recovery, a person will often be plagued by the symptoms of being a dry drunk. Dry drunk syndrome can loosely be defined as an alcoholic or a person with alcohol use disorder who abstains from alcohol for a period of time but continues to have the symptoms of a person that is still living with an active alcohol addiction. We get two different categories of dry drunk syndrome. The first would be individuals that have received treatment for their addiction, but that stopped attending the therapy, follow-up sessions, that does not go to their support group meetings, they don't follow a relapse prevention program, and they think or believe that drinking alcohol or stopping to drink alcohol is enough to recover. Secondly, you get those suffering from substance use disorder or alcohol dependency that never goes for treatment, but they quit drinking because of all the pressure that they receive from family members and, of course, also due to the negative consequences that their drinking causes for them. Dry drunk behavior will vary from person to person, depending on the length of time that they have been using alcohol or on what regular basis they have been using alcohol in what amount they have been using alcohol. For those with a serious addiction spanning across several years, and those who have mental health issues, it may complicate matters, and the signs and symptoms will probably be more pronounced. We get certain symptoms that we can identify to see whether a person could possibly be in the process of building up to a relapse or possibly that of dry drunk syndrome. Firstly, we often see that they become nostalgic about their drinking days. They think back on the days that was better, the days that they were happier, the days that they coped better in the workplace or in their relationship. And they may even go on to romanticize the substance. We also often find that they suffer from severe mood swings, from, for instance, depression, going to irritability on a regular basis. Impulsive and risky behavior also very often noticed, and they often tend to take in the role of a victim, and they are full of self-pity. They often also experience difficulty in concentrating on anything, and their thoughts are mainly negative. They, at this stage, are extreme high risk for a relapse. How can we avoid dry drunk syndrome? The most important thing here would be to remember that alcohol use disorder is a chronic disease. It's treatable, but it's not curable. Therefore, the treatment starts with rehab, where you go for your treatment, where you are detoxed and literally dry after the detox. But during that treatment, it is of utmost importance that the underlying causes and triggers for your substance use and abuse should be addressed. There is also a very important part of therapy where the patient needs to gain insight into their problem. So they need to be able to, at some level, identify what was the purpose, the function of the substance. So what do I mean by function of the substance? This will vary from individual to individual. But for instance, for one person that's very introverted, shy, and finds it difficult to communicate, the function of the substance may have become one where it gives this person a little bit more confidence. It helps them to relax a little bit in social settings, and it makes it easier for them then to communicate. Also, it is important for the patient and the therapist to try and understand what makes it difficult for this person to cope emotionally, because mostly it is emotionally. Circumstances we can't necessarily change, and these circumstances has an impact on our emotions. If we can learn to deal with the emotional impact, then the need to want to escape the emotion and the reality that they are confronted with will grow way less, and they will feel that they are actually in control of the problem. So in thinking about how to prevent the dry drunk syndrome after treatment, the maintenance is very important. You should go for your follow-up sessions. You should join a support group. You should try and find a sponsor that you can contact when you are in trouble. It is also very important to follow a relapse prevention plan. And then obviously to identify which family members will be your support system. So when you are feeling down and when you are feeling out of control, that you can go to those people for support. I hope I've shed some light on this topic. And if there's any questions with regards to this, please feel free to contact the centre, Stabilis Treatment Centre, and we will gladly assist you with your questions. Thank you. Goodbye.